Welcome to the final expo of UN 2.0 week. We've explored innovation, behavioral science, data, digital, and strategic foresight. And today it is an honor to bring to you this conversation around culture at the United Nations, transforming our culture, to be more specific. We're going to explore how culture transformation is creating the conditions for lasting change. Showcasing UN teams who are shifting mindsets, practices, systems through inclusive dialogue, behavioral approaches, human-centered design, and more. In the chat, please share your name, your organization, where you're joining from. We'd love to know more about you. And we know that it's late for many of you, so thank you so much for being here on a Friday evening, night. My name is Liliana Oruro. I work in the Secretariat's Business Transformation Division, and I'm one of the stewards of New Work. This is a grassroots network that has been striving to accelerate culture change. Julia, don't see the slides moving. Thank you. Thanks. Striving to accelerate culture change since 2019. What's a little bit different about New Work is that it's not mandated from above. It's grassroots, as I said, and it's led by entrepreneurial employees who collaborate and connect across silos, share good practices, and aim to minimize duplication across our organizations. Before we dive in, though, I'd like to invite you to join me in a mindfulness practice. This is to encourage us to be fully present and engaged in the moment. We have lived very busy lives. We're always busy. And so this is just a moment for ourselves. So I'd like to invite you all to please stand up if you can and join us in this practice. Close your eyes, stretch, whatever you feel comfortable. Begin to become aware of your body, your thoughts. We're going to start with 3 deep breaths. And then you breathe in, breathe deeply, feel your lungs, feel your ribs expanding, feel your belly expanding. Hold a moment, and then release. Feel the air reversing. And when you get to the end, push a bit more out. Once again, breathe deeply through your nose. Feel it going through. Can you expand a bit more? And release. Let it all out. One last deep breath. Fill your belly. Sigh it out. Suspend the judgments. What are your thoughts? What are you feeling? Are there parts of your body that feel stressed or tight? Can you send energy to that body part, to that space? Try to release. We want to get rid of, or at least release our judgments, our biases, and be fully open and present. Create a positive intention. What's your intention for this event? What do you hope to learn, to see, to explore? What do you appreciate about the situation? What do you appreciate about this week? And with that, I invite you to sit down again, and we will continue. I'd like to introduce our panelists today, our speakers. Very excited about this. Starting with Luis Cervantes from UNDP, Huda Kake from UNFPA, Angelo Gallardi, sorry about that, from UNICEF, Gabriel Tuan of UN Women, and Samuel Freiberger of the World Bank. Now, each of these panelists will have 3 minutes to share their idea, to share the work that they're doing. And then at the end, we will open up for questions. So with that, I'd like to turn it over to Luis.
Thank you. So the challenge that we're looking at pertains to the right of Indigenous people to be consulted prior to any project that may affect their way of life. There's wide evidence supported by the work of organizations and Indigenous rights activists that points to the fact that in Mexico, this human right is often violated. But there are also some very good examples of consultations that took place and they ended up in good synergies. Now, upon deeper understanding, we realize this is not a single issue, nor there is a single way of making it right, but to tackle this, we needed to understand it in its complexity. So where do we start? We are aware of issues like women's difficulty to being heard in these spaces that are common barriers for development and for which we have experience dealing. But some other problems are trickier, like the complexity of identifying who is to be consulted in settings where Indigenous people can coexist with non-Indigenous. So our first task was to create a map as comprehensive as we could of all issues. Community participatory research revealed a bunch, which we organized into 16 distinct categories. While some of these issues were typical for UNDP projects, others were unexpected and specific to the context. For example, the fact that the mere length of these processes affect local communities in ways people did not anticipate, and they ended up feeling emotionally drained when consultations lasted more than 2 years, absolutely regretting their initial acceptance of the process. Our next step to applying systems thinking was to identify specific positions that were relevant to the design of solutions. 3 different groups were formed, all of which included members from Indigenous communities, as well as experts and practitioners from various academic backgrounds. In the first group, participants examined the rules, focusing on the lack of regulation and establishment of a solid legal framework. The second group considered the methods of consultations, including pedagogy, timing, necessary qualifications, and the way information is presented. And finally, a third group, comprised by psychologists, sociologists, and anthropologists, analyzed the historical context, incentive systems, and power dynamics at bay. We, of course, invite you to download the report. Unfortunately, it's only available in Spanish, but I'd like to share with you 2 key learnings regarding the impact of this publication. First, system thinking is proving invaluable in establishing common ground. By examining issues from a system perspective, we're able to attribute responsibility. Can you go to the next slide? To the way, by examining these issues from a system perspective, we're able to attribute responsibility to the way actors are organized and path dependencies that have been put to place. And secondly, human-centered design and participatory community-led research has been highly effective in prioritizing what people value most, focusing on solutions that may not initially appear to be the most impactful, but generate a unique momentum. Thank you. My 3 minutes.
Thank you so much, Luis. It's super interesting. It's really nice to see, that it's not just about numbers, but that, there's impact, emotion, and connection. Uda, on to you.
Okay, thank you, Liliana. Can you imagine how much 14 years of crisis in Syria can increase the GBV? I'm going to speak about the changemaker applying in the Shakirwa model as a GBV prevention program in Syria. Next. Next, please. Over a decade, the crisis led to increasing GBV, especially about 2 practices: intimate partner violence and early marriage. Culture and religious norms often justify and normalize these practices, and survivors face stigma, limited support, and community silence. The opportunity was to introduce the changemaker, which is the adaptation of the Shakirwa prevention program, which was implemented in Rwanda previously and being implemented in Aleppo to address IPV and early marriage. It's related to engage couples and community leaders through raising awareness session, dialogue, empowerment to become more community activists themselves. Next, please. How? What is this new approach? It is a multi-component intervention which consists of 3 phases: couple colloquium, which focus on gender dynamics, healthy relationship between couples, joint decision and economic planning, targeting couples, leader colloquium targeting harmful beliefs and promoting change, then community mobilization via training the participant to lead change via theater, dialogue, and media. This contextual and trauma-informed, designed for Syria culture and conflict-affected context, and promote self-reflection, dialogue and shared learning, and grassrooted leadership. Next. What is the impact and the resilience of this program? It showed promising result actually. The intimate partner violence reports decrease in women opinion from 79% to 44%. Justification for IPV also decreased from 40% to 7%. And for women from 31% to 19%. Even for early marriage, it was decreased. The opinion of men to marry their children before 18 decreased from 39% to 9%. However, for women, it raised due to many reasons explained in the project study. And it showed that it's very effective even during crisis. For example, we faced the earthquake in 2023. However, it showed also adaptability to being adaptive and being fragile to the setting. What is the action to take from this program in order to keep changing and affect changing harmful practices? We need to include donor, government actors, and civil society. They must invest in this prevention program and to continue invest in Syria, as it is now, the political changes, and there is a future to change the harmful social practices related to GBV in general. Thank you very much for your listening, and over to Liliana.
Thank you, Huda. Thank you so much. It's great to see, something applied in Rwanda and then adapted, taking something that worked in one place and building upon it and adapting for a new location, rather than reinventing something completely new. I think it's really important that we start to do that more across the system. Thank you. Now on to Angelo.
Yes, thank you, Liliana. Good morning, good afternoon, everyone. So the few following slides is going to describe an intervention which aimed to pilot the application of behavioral insights and human-centered design to increase the uptake of routine immunization, with focus in 2 districts with high number of zero-dose children in northern regions of Mozambique. So a bit of a context, Mozambique is experiencing in the recent years a decrease in the immunization coverage, the routine immunization coverage, with important negative effect on child health and development. The trend started in 2019 and it accelerated in 2020 and 2021 with COVID-19 pandemic. Next one. Given this context, so the urgency of intervening in terms of increasing again the immunization coverage, UNICEF decided to pilot the application of behavioral insights, more generally the behavioral science approach to support the uptake of routine immunization. So a bit of details. We analyze primary and secondary data, quantitative, qualitative data. We triangulated the available data that we managed to collect, and we come up with a behavioral mapping, trying to highlight what are the most relevant behavioral determinants that impact the uptake of routine immunization. We moved to a prioritization and ideation workshop. We co-designed, and pre-tested a set of possible prototypes, obviously with the participation of Ministry of Health, with active participation of local stakeholders. And at the moment, we are finalizing the experimental design, and we move to the implementation in next month in July. Next slide. So we find out that several determinants that, let's say, related to all the 6 moment of the health journey, immunization journey, are impacting the routine immunization in Mozambique. However, taking into consideration that we cannot address all of these aspects at the same time, and considering that several SBC interventions are ongoing in country in terms of increasing demand of the service, we decided to focus to address the health center, the health facility perspective. Next slide. In particular, we decided to facilitate the access to the service, as well as improving the service experience. Next one. Through the process I just described, we come out with two main prototypes to be implemented, which is the combination of behavioral insights approach into the more traditional interpersonal communication trainings, supported by job aids like communication guides and sort of SOPs to facilitate the relationship between service providers and service users, as well as regrouping the subsequent appointment based on a community of residents. This idea is looking at, in a way, fostering, supporting a sort of organic preference from service users. And also looking at the all the intervention that have been selected, looking at the possibility of scaling up with low cost and particularly relevant for the context in Mozambique. Thank you. Over to you, Liana.
Sorry, apologies, my throat. Thank you so much, Angelo. It's really interesting to see, application of multiple approaches, human-centered design and behavioral science. Now over to Gabe for Transformative Spaces.
Thanks very much, Liliana, and welcome all of you change makers. You're part of thousands and thousands of people around the world who are doing amazing things, who want to do amazing things. So I'm going to pose a question for everybody. Before we hit this slide, do you know that every mindset, interaction, everything that you do has an impact? Think about that. Every single intent, action, belief, and engagement that you have has an impact on someone who is connected to somebody else, who is connected to the planet and the societies that we work in. And so if we think about that collectively and intentionally, we can foster incredible spaces where people can be included, to bring curiosity and co-create things for change. And we are in the business, if we shift to the slide, our business is transformational change. We live in a profound moment, and there's been many moments, but right now, as we know, we live in a profound moment of global transformation. And we all have a role in being able to create a space where we can invite all people with all voices in all their diversity and inclusion to have an opportunity to co-create the changes in structures and policies and practices and power relations for greater well-being of our planet, our society, our individuals and organizations. So our businesses change, and we're all change makers, and each of us are all called to lead. So so what's going to help us? Okay, for all those of you who are gardeners or would like to garden, imagine what do we do to help a garden grow? What do we water? Okay, so if you imagine a garden, okay, what we do to grow trees and our plants. So let's take that analogy to the way that we work with our people, with our teams, our stakeholders, our governments, and our societies. Underneath the surface, it's the quality of the relationships. It's the mindsets that we bring. It's helping people connect to purpose and their creativity and the communities and culture that we're aware of. And what helps us get there? our ability to listen deeply to each other, to practice mindfulness, as Liliana said, to take a pause and to really allow people through a multitude of multi-sensory participatory practices will help us get there. So Transformative Spaces is a series of workshops, but more importantly, it's a series of practices that you can bring to any meeting, to any engagement, to any workshop that allows people to pause, reflect, use all their senses and all their creativity, and most importantly, to listen to each other, to co-create something for a better future. Thanks, Liliana.
Sorry, I couldn't get my mic open. Thank you so much, Gabe. And having participated in one of Gabe's workshops, I can tell you that it's truly mind shifting. So hopefully you will all be able to join a workshop in the future. Now we are on to the next slide. Yes. Last but not least, we have Sam Freiberger from the World Bank. And Sam, are you here? Yes. Welcome.
Hi, everyone. Thank you, Liliana. Well, thank you for attending this talk. Now, I would like you to imagine scrolling through your feed, your social media feed, and seeing hate speech. It is targeted, it is inflammatory, and it is dehumanizing. Now, imagine that the same digital hate is erupting into real-world violence. This is not hypothetical. It's actually what's happening around the globe. A recent global survey by UNESCO and Ipsos finds that 67% of users frequently encounter hate speech online. And in places like Nigeria, we found in our work that using custom large language models, we can identify spikes in online hate that align in real time with violent events happening underground. The problem is not just toxicity, it's destabilization. It harms society, especially in the global south, where platform governance and content moderation are often the weakest. The problem is that traditional moderation, as we know, such as removing posts, is not only slow and opaque, it is deeply limited. In fact, leaked documents show that platforms such as Meta may take down as little as 5% of hateful content in countries like Nigeria. So what can we do? Next slide, please. No, the slide before, please. No, there should be a slide in the middle.
I think that's what we have in the deck, unfortunately, Sam.
Okay, so let's just move to the next slide. Let me just talk over it. So what can we do? We designed a scalable right-respecting alternative, celebrity counterspeech, delivered through targeted ads. Here is how it works. We build a large language model specialized in hate speech detection that is fine-tuned on the Nigerian Twitter ecosystem of over 10 million users, and we identified clusters of users amplifying hate. We then randomly assigned half of these clusters to receive short pro-social video ads. These videos, they featured popular Nigerian influencers delivering a simple but powerful message. Hate speech leads to violence. Violence destabilizes our country. This approach is proactive. It's not reactive. It doesn't censor, it speaks, it doesn't punish, it persuades, and crucially, it scales. So what did we find? Well, we found that this message worked. Original hate content dropped by 4.7% across targeted users, and the effect persisted for at least 6 months post-treatment. But even more interestingly, we saw positive spillovers. By interrupting hate retweet chains, we were able to reduce the amplification of hate speech beyond the treated users. And this is not just effective, it's cost effective. So compared to traditional content moderation, this approach is at least 25% cheaper in the Nigerian context. And hate content that would have been spread for days or weeks before being removed now never appears. So here is the call for action. Let's invest in solutions that meet people where they are online and speak in voices that they trust. Tackling online hate isn't just about moderation. It's about reimagining platform governance with interventions that are systemic, scalable, and rooted in dignity. Thank you.
Thank you so much, Sam. And sorry about your slide. I'm not sure what happened there. But we have one question. I see, Angela, you answered one question in the Q&A already, and I certainly invite you all to pop in more questions. There is a question, Gabe, about how to get more involved in transformative spaces.
Thanks, Liliana. We run regular workshops every month, which are open to everybody. So we will publicize those. We bring a whole set of practices that you can use in any moment and in any situation. So we'll share those in there. And you can also contact me or Liliana or anybody if you'd like to talk more about those, if you'd like to see how you could use these practices within your own meetings or in your own workshops or in your own engagement. Thanks, Liliana. Thanks, Beth.
Absolutely. Yes, and yeah, we are open for Q&A. And you can also in the chat just let us know something you learned today. Love to hear from you. There is another question for Sam. Do you think that online hate does economic disparity or racism contribute to it?
Yes, I think there are obvious economic factors that contribute to it, and that there are also deeply rooted beliefs that are not purely structural or economic based on economic factors. But I also think that the point of this work is not to say that platforms are the only mechanism that contribute to hate, but obviously there is plenty of evidence showing that it has contributed to its propagation over time. And so it's not the only solution. Obviously, there are other factors to tackle to reduce online hate, but we think that this is one of the stepping stones to think about a holistic view of how to address these issues.
I have a question for all, actually, and in terms of these initiatives, I know, Angela, for example, you're saying you're just prototyping, just starting pilots. What are your plans for scaling? And you've learned, you've applied behavioral science, human design, etc. You've learned a lot, dialogue, including communities, bringing community to. How do you plan to scale at this point? And then maybe let's go in order. We can start with Luis.
Thank you, Liliana. Okay, so in our case, UNDP is undergoing transformation, and as early as this year, a new procedure was put into place to enable a new programmatic structure in UNDP that we're calling portfolios, and which is enabling the organization to think of putting into work projects that are comprised of a diversity of interventions that are intertwined. And with this particular research piece, what we're trying is to set down the foundations of a new portfolio in the subject of Indigenous consultations. And that's the way that we're trying to scale it up now, by trying to present it in as many forums as we can and bring new donors to the table to look at issues from this perspective.
Thank you, Luis. Huda?
I will pass it to my colleague Fatima. She is our GBV specialist in Syria. Yes, Fatima, please go ahead.
Thank you, Huda. Good morning, good afternoon, good evening, colleagues. Thanks for asking this question, but it is a little difficult for a context like Syria, right? For 14 years, we have been in a very complex situation, and the change of the government in the recent, like past months, right? And also what is going on in the Middle East in past few months, we are all are witnessing all this. Aleppo, where we are implementing the like in the Shikaria model, that is one of the like area where a lot of displacement has been happened, and this location is close to the Idlib that was managed by a different authority, right? Uh, and recently, many displacement and return is happening in Syria. Even in Aleppo, so many return is happening. So when we will be doing the inline survey, now we are in a position to implement the activist curriculum that Huda has mentioned. So once we are implementing this in next 12 to 14 months, then we will do the inline survey. The result will give us some like new learning, of course. It might be changing the way we are expecting the result, or it might be really surprising us with a very positive result. So we are really looking forward to the implementation of the activist model. But in the meantime, UNFPA is also observing, because in the current context, there is a really need to bring the social and behavior change component because of all these displacement and return that is happening in the new Syria. So we are hoping to expand nationwide the model, considering the many different formative research we are planning to do on the on the behavior change aspect, and of course in the Shikiri, one of the best model we are hoping to implement nationwide in Syria based on the baseline assessment that we'll be conducting. Yeah. Over. If you have further question, happy to respond.
Thank you so much, Fatima. It's indeed a complex situation you're dealing with. Angelo, how about you in terms of further scaling?
Yes, thanks for asking, Liliana. So I would say, I mean, for UNICEF, the support to routine immunization is a key global priority, right? And it's, I would say, particularly relevant for the context of Mozambique, for the reason I just presented, right? For the reducing in coverage of routine immunization. From an SBC perspective, social and behavior change perspective, we are currently supporting several interventions in terms of increasing the uptake of routine immunization. I would say mostly looking at increasing demand of service. With this project, with this pilot, we wanted to shift a bit from looking at the issue just from a service user perspective, right? Or better, looking at increasing the demand of the service and looking a bit from the perspective of the service providers, trying to improve the service experience, given we believe that the pure service experience is contributing to a drop, right, in the routine immunization coverage. As I mentioned, we are now approaching the implementation, so hopefully we are going to get positive results. In the scale up of the intervention, first of all, covering. Can you hear me?
Yeah, your connection is a little bit unstable.
Sorry. So just saying that we are now approaching the implementation and hopefully we are going to get positive results. The idea is obviously scaling up in prioritizing the high number of zero dose children districts, so districts with high number of zero dose children with a lower coverage in terms of routine immunization, and is definitely one of the key priorities for us to keep supporting the routine immunization and shifting a bit from just demand to trying to provide a more effective, I would say, service. Over.
Thank you, Angelo. Gabe, how about you?
Thanks, Liliana. We're doing it in a couple of different ways. One of the important things, for example, in UN Women is every time there's a retreat or there's a leadership workshop or there needs to be some problem solving, we bring these range of listening practices, visualization, pause and reflect, deep reflective questions to all of the scenarios that people face. So it's about bringing a practice to any situation. And for example, if there's cohorts of managers for the Ladera, which is the UN Secretariat group of leaders, we created 2-hour workshops where we explored the concept of well-being, but in a way that helped people connect to their purpose, their own mindsets, to their own situation. And what we do is try to bring safe, inclusive listening practices to all of those spaces. So we apply the same practices, and they're fully participatory. And the most important thing, everybody is a peer. We don't come to tell people what to do. We create a space for people to connect to themselves and others and co-create. So we are working with the UN Staff System College to create an intentional space so that we regularly run these sessions, so anyone can bring any issue or any challenge, and we can bring these practices to help co-create and connect to them. So there are a couple of the ways that we're doing it now. Thanks, Liliana.
Thanks, Gabe. Sam.
Thanks, Liliana. So it's very inspiring to hear everyone's stories and projects. So at some level, the things we're already doing are already aiming to scale, at least at the country level. So this was an intervention that I mentioned that targeted hundreds of thousands of people, identifying a population of almost 10 million. And that's orders of magnitude higher than what many offline interventions are targeting in terms of sample sizes. But obviously, we're looking to grow this kind of interventions. We're looking at growing it across different platforms. We're growing it across different geographies. And we're growing it across different types of outcomes, such as gender-based violence, such as misinformation, and so on. So there are obviously barriers for doing that. I don't want to say that it's a silver bullet. As we all know, there has been a policy shift within major social media platforms when it comes to content moderation and openness, which drastically limits the capacity to observe what's going on and to intervene as well. But we don't think that this means that nothing can be done. And in particular, thinking about this in terms of what can be done within the ecosystem of these platforms through targeted ads, we think is a very promising avenue for scaling this, as I said, across geography, platforms, and outcomes. I think it is part of the ecosystem, and that there is a lot of space to do more of these kind of interventions. And we're in fact doing more of these kind of interventions on platforms such as YouTube. We are focusing also on intervention around gender-based violence in India and Kenya. So we think there is actually a lot of work that can be done and will be done in this space over the coming years.
Thank you so much. There was another question in the chat. Fatima and Huda, you mentioned already, the difficult situation in Syria, and we're seeing this kind of the climate that we're in, the world is in. There is, pushback against inclusion, against diversity, even against gender. How, and someone's asking us, like, how can we reverse the cultural messaging? Yeah, and I mean, obviously, Sam, your project speaks directly to that, right? But in your work, for example, with Indigenous peoples or with people in Syria, are you seeing that this kind of initiative is helping to counter those negative messaging. And leave it up to you.
Yeah, thank you,
Dispatch.
Liliana. I think from the third point of view, and after interacting with people, people need to speak and to be, to be more heard. They need to interact and they need to express themselves. They need to understand really what's the meaning of GBV, what is the intimate partner violence. At many occasions, women, they don't know that they are suffering from intimate partner violence. They don't have the awareness. That's why, raising awareness concerning these issues is very important. Then teaching the people how to interact more effectively via interactive tools like dialogue, like theater. They can express themselves more, and this is really reflecting on the field level. That's why the model we adapted already is showing very remarkable results. And as mentioned by Fatima, now we will start testing the transformative approach by making these people the let's say change makers by passing this information, and they will going to be sharing the knowledge they already gained with their own communities. Then we will see, we will test. After all, as mentioned and explained by Fatima, we are working in a very, very challenging, changing environment. So this is the experience. Thank you.
Thank you so much. Okay, please, do you want to jump in?
Thanks, Liliana. That's a really great question. And I think it's one of the questions. So there are two things there is we need to create spaces where we invite people in. And one of the biggest challenges is, do we only invite people in who all share the same perspectives, or do we invite others in who have different perspectives and maybe they're at odds with what we feel we should be good? But if we don't invite all, we'll only be co-creating with just the few who all have the same view. So I think one of our biggest challenges, and I think greatest opportunities, is to try and put aside our own biases and our own judgments and to create a space where we welcome everyone in. But then use the practice in that space. The principles are we do listen to each other. It's a space where we have to intentionally remove the hierarchies and power imbalances and power structures out of that space, and facilitate an opportunity where everyone's voices are heard. We use all of our senses and we really connect to why are we here? What is the future we really want to create? And what we've found when we've done that, and we've done that with multiple teams and people from all over, it creates a real opportunity and energy for people to connect. At the end of the day, we're all human beings, and what we're trying to do with transformative spaces is to get people to connect deeply to themselves and connect deeply to each other, and then to allow that co-creation to come from that. But we won't do it just as an intellectual exercise. Okay, this is an opportunity to really connect in all of our mind, body, spirit, and the planet, why we all exist here. Doesn't mean it's easy, because that's not our natural. We tend to react at the moment with low levels of trust. So it's an intentional space. And Liliana, your mindfulness practice that you did right at the beginning all encourage us to stop and suspend some of our bias and judgments. So that was a perfect example of inviting people into a space with intention. Thank you.
Thank you so much, Gabe. Yes, indeed. And that was the hope and intention of the mindfulness exercise. Huda, you mentioned theater, and I wanted to, this is something that came up actually in the previous, in the high-level panel, the opening session for today, about the arts and, expression. And I wonder, if all of you have seen, obviously in social media, people are expressing their artistic and endeavors through there, or in the Indigenous communities. Have you seen examples of, the creative arts coming into play and having an impact in the work that you're doing? And again, I'll leave it up to each panelist if you want to answer the question. Don't want to put anyone on the spot. Oh, we lost Huda. Luis, did you want to say something? Yeah, okay. All right. So I would like to then thank you all for, and Julia, if we could just pop up that slide, we're going to ask all of you to share with us in the chat. Again, have you learned something here today that could make an impact to your work? I certainly have. It's fascinating to see that these kinds of approaches and frameworks are being applied to real world complex challenges that the UN is facing. A lot of my work is focused more on the internal culture of the UN, but it is not just about our internal culture. As Ayaka mentioned this morning as well, it is about the UN and it's engaging with the world. And as Gabe pointed out in his, we are all part of this transformation. We are all part of this organization, this system, many systems really, and changing these systems and making fundamental changes. Hierarchies are not just within our UN organizations. There are hierarchies in governments that we're dealing with. There are hierarchies in the civil societies that we engage with. And having these sets of tools to get data and to really understand, what is the real behavior change? We make a lot of assumptions, a lot of biases, and we judge behaviors a certain way. We don't know what's really behind it. And so, having these kinds of interventions and dialogues and true, sitting down and understanding people and hearing them helps us to uncover what are the real issues behind, what are the real obstacles, and then we can develop solutions that actually address those issues. Again, what came up earlier as well, that the UN is going through a very difficult period, and I think this kind of work is often, this learning, those are the things that get cut first, but this is what is so critical in order to make the UN even more effective, and to help more communities around the world. We fundamentally need this kind of transformation, and we need that space to have the creativity to co-create solutions that'll have real impact. There's one last question in the chat. Maybe I can quickly address. We do have a couple minutes. How do we start talking to those who may not believe in transformation along the lines of UN 2.0? One thing I've noticed is there's plenty of enthusiasm from young people and others who really believe in the agenda, but how do we pull others that may be more resistant into the loop? And that is a question that certainly we've struggled with over the years. I think we all struggle with that. But you have seen that there are senior leaders here this week who are supportive of this kind of change. And having them involved. I know, for example, there's some programs piloting in the UN on reverse mentoring. So a senior person is coupled with a more junior person in the organization. And the senior person can, provide some insight into how the organization works, give them some knowledge, but the young person can often teach senior person, more about technology, some of these new practices. And so, advancing some of those things, and certainly inviting senior leaders to participate. Why not participate in these dialogues and in these types of interactions? It is not easy. I'm not saying it's easy, but we all can make a difference, and we all can have an impact. I really firmly believe that. It doesn't matter, how young you are, how not digitally native you are. Everyone has value to add, and working together and collaborating together is really the key thing to draw out all the various experiences and skills. So with that, again, feel free to keep sharing in the chat. And I'm going to, now, if Julia, we can go to the next slide. As I said, this week has been about UN 2.0 and all the various aspects. We have the quintet, which are the digital skills and capacities that we're trying to develop across the UN system, and of course culture underpinning that, because you can give people tools, but if they're not open to really using them and applying them in a consistent way, it's just not going to have the same impact that it could or should. So please sign up for the communities, keep the conversation going. This is the last official event. There's still a few more side events happening this afternoon, but it's been an amazing week. Thank you to everyone who's joined us. Thank you for all your comments and questions. And again, please sign up, join up, keep the conversation going. You can also follow us on LinkedIn. And thank you again to the panelists. And I would like to send a big thanks also to my colleagues who've been coordinating and running all these things behind the scenes. It's really been an amazing week. Thank you.
Thanks, Liliana. Thank you, everybody.
Thanks everyone. Thanks, Liliana.
Thanks for the invitation, and thank you everybody who joined in.
Thank you. Thank you for inviting. Thank you.
Take care.
There you go. You can follow us on LinkedIn. All the videos, the recordings will be made available this week.